I came to United States because I was interested in neurology. One of the mentors that I had was an epileptologist, and I was impressed by the care that he was giving his patients, and I was impressed by how his patients felt after they left the visit, and that got me interested in epilepsy. It's a perfect marriage between medical field and technology, and that's what excites me about this field. I'm an adult epilepsy provider. I mostly see patients with seizures and epilepsy, 18 and above. The first visits are a little bit longer. It can take anywhere between 30 minutes to 60 minutes. One of the first questions that I ask my new patients is, what are their goals or expectations from seeing us? In terms of epilepsy care, we dig deeper. We go all the way back to how they were born, any complications, any risk factors they might have that help us prepare in providing the appropriate treatment options. We do see patients at different levels of their journey through epilepsy, someone who's newly diagnosed versus someone who has had seizures for many years. We have radiologists that are working with us. We have neurosurgeons working with us. We take input from all of these experts in their fields when we are proposing complex care. 60–70% of patients only need medications, but that small proportion of patients who require more than just medications, we offer in-depth surgical analysis to see if surgery is an option in the first place. If that's not safe or if that's not something that the patient prefers, then we approach it with something called laser surgeries. And sometimes we use neuromodulation devices. Think of these as pacemakers for brain when we cannot do a safe surgery, yet we need something to control the seizures beyond medications. We do offer virtual visits because navigating and not being able to drive for some of these patients can be challenging. Sometimes we ask patients to come and stay with us in the hospital where we get a lot of information about their seizures. This is done through Epilepsy Monitoring Unit Evaluation, or EMU. Knowing that I have been a part of making someone's life a little bit better. Right? We may not be able to fix all the problems, but if we can point our patients in the right direction in terms of getting a little bit better in their life, that's what makes me happy at the end of the day. When I'm not in the hospital, most of my time is spent with my toddler at home. Takes up a lot of time, which is quite exciting. I've recently picked up running as a hobby, again inspired by one of my colleagues here at work.